Symposium. Welcome, Audrey.
Thank you, Jocelyn. As mentioned, my name is Audrey, and I have the honor of presenting today's fifth presenter. This session of today's symposium is sponsored by Memorial Healthcare Services. Dr. Taren Zakaria will be discussing the topic, How Do I Choose My Seizure Medicine? A step-by-step approach. Dr. Taren Zakaria is a board-certified neurologist who specializes in neurophysiology and epilepsy. Prior to joining Memorial Healthcare System, Dr. Zakaria served as the director of the epilepsy program and as co-director of the epilepsy surgery program at Norton Neuroscience Institute in Louisville, Kentucky. Dr. Zakaria earned his medical degree from Damascus University in 1998 and completed his internship in internal medicine at West Virginia University, Charleston area Medical Center in 2005. He completed his residency in neurology at the University of Cincinnati Medical Center in 2008. He completed his fellowships in neurophysiology and in epilepsy at the Mayo Clinic College of Medicine, where he later served as assistant professor. Dr. Zakaria is also an Epilepsy Florida board member. Please welcome Dr. Taren Zakaria.
Thank you, Audrey. Thank you, everyone. I want to start by saying how grateful and honored to be here today. I want to thank Epilepsy Florida. I want to thank Dr. Kachani for this invitation and to be part of this beautiful meeting. I always love to be part of this kind of activities and meetings, speak directly to our patients. I think having this strong communication and strong relationship between the physician and the patient is really the key in order to make progress and try to help our patients who are challenged with epilepsy. I think that will enable us to understand each other more. I think that you will hear how we think and what's the rationale behind what we do. And also we will get the opportunity to listen from you, to hear your concerns and your questions. So again, thank you for having me tonight or this afternoon. My topic will be how do I choose my seizure medication? And I picked to say how do I choose as a patient instead of a physician, even though it's really it should be a mutual decision between the patient and the physician, how to, where do I start? Like we mentioned before that there are more than 26 different medications. There's a lot of new medications. And the questions, or the question often asked is, how do I choose my medication? How to establish that kind of dialogue with my physician help me to understand why medication A is better for me than medication B. So we're gonna start by going through this as a step-by-step process. Next slide. We'll start with some basic facts about epilepsy. Some patients ask what's the difference between epilepsy and seizures. Epilepsy means a condition that you have a higher risk of having seizures. So whenever you have a diagnosis of epilepsy, it means that you are at a higher risk of suffering or witnessing seizures for some time in your life. Each seizure is defined as a disruption of the electric activity in the brain, leading to a very specific symptoms and signs. The question really comes, when do we call the diagnosis of epilepsy? After how many seizures you have to have before we say that you have epilepsy? And this is a very important question when we talk about medications, because we will see that the timing of medication correlates with the diagnosis of epilepsy. Most of the neurologists believe that once a patient has 2 or more unprovoked seizure, then it's time to call this as epilepsy and try to talk, it's time to start talking about medications. Now, I strongly believe also that there are a lot of patients who might benefit from medication even after the first seizure, if the risk of having the second one is very high. So after the first seizure, we reevaluate, we do all the testing, we try to define what are the chances of having another one. If we find the risk of having another one is very high, I personally believe that we should be on medication to prevent having a second seizure. When you have 2 seizures, then it's not anymore question. There's no anymore question of whether we should be on medication or not. After having the second medication, second seizure, your risk of having a third one is extremely high. It's around 90%. And that's definitely the time to talk to your physician about starting a medication. Next slide. So it's a busy slide, a lot of numbers, but I wanted to focus on the last line here. 6 out of 10 cases of epilepsy, we still don't know what's the reason or what's the etiology or what's causing the seizures. And that's something that for me is very interesting, because even though we are in the 21st century and we have all this technology and testing and MRIs, and we still don't, there is a very high percentage, 60% chance that if you have epilepsy, we might not be able to find the reason or the etiology that causing the seizures. And that can be very challenging for you and for the physician trying to select which medication that work the best for you. Next one. Next slide, please. Okay, so remember, let's go back one slide. Here we go. So as we go through this process, our eye should always be at the finish line. I'm not trying to talk politics. I know you heard this sentence multiple times over the last few days. What I'm trying to say here is we always have to look at the goal of what we are trying to do. The goal of treatment is to have no seizures, at the same time, to have no side effect and have the best quality of life that you deserve. It doesn't work that you have a medicine that controlling your seizures 100%, but you are miserable every day from the side effect of the medication. You cannot wake up in the morning. You cannot go to work. You cannot drive. You cannot function. You cannot think. You cannot remember. It doesn't mean much. Yes, we feel good about ourselves. We stop the seizures, but we have to address the whole package. We have to look at the condition, at the disease from different angles. We have to be sure that the patient, like been discussed before, the patient has the best quality of life that he is entitled for. Next slide. So before we start the medication, I want you to talk to your physician. Ask him, is the diagnosis confirmed? And that's the most important question, because there's a lot of things that can look like a seizure, but it's not a seizure. And before we go through the path of medications and start trying one after another, I have patients who've been on 4 or 5 seizure medications. And then after maybe 5 years or 10 years, we come into conclusion that, oh, it's not epilepsy, it's something else. So diagnosis of epilepsy is not easy. It's not straightforward. There's a lot of testing needs to be done. There's a lot of information that need to be obtained before we make that diagnosis. So before you start the medication, talk to your physician, talk to your neurologist, talk to your epileptologist. Are you sure? Why are you so sure that I need medication? What's my diagnosis? What kind of epilepsy I have? And then once he tells you you have the epilepsy, the next question is, do I need to be on treatment? Especially this applies after the first seizure. Like I mentioned, what are the chances of having another seizure? Do I need to be on medication to prevent the second seizure or not? Those are great questions that you have to talk to your physician about before you start the process of selecting the medication. Next one. So seizure medications are the first and the main line of treatment for epilepsy. I know we heard a lot about surgeries and devices and therapy, but the first step, once we have the diagnosis, once we know for a fact that you have epilepsy, that you have a high risk of having another seizure, the first step is with medication. So let's go through the process and see how we can choose this medicine. Next slide, please. So things that it's a must, that we should think about and reflect upon before we're choosing the medication, both the physician and the patient. The first thing is what type of seizures. We know that there are medication work for one type and there are medication work for the other type. So it's important for us as a physician and you as a patient to know that, am I on the right medicine? Am I on the medicine that's gonna control my seizures? So the first question is what type of seizure you have, and that will help me to select, to narrow this 26 medication that we talked about, to help me to narrow it to a lot fewer medication that might be more specific to your type of seizures. The second factor that we need to look at is your age, your gender. If you are 20 years old and you are a young female, it's so much different than treating an 80 years old gentleman. These two patients should not be on the same medications. The age and gender has a lot to do or have a lot to do with our selection of the medicine. The third factor is the medical problem that the person have. We just heard that there are so many other issues that patients with epilepsy can have. I talk about them very briefly: headache, depression, anxiety, memory problems. All this has to be part of the process of which medication I'm going to choose, trying to treat as many more problems with one medication. That would be the ideal situation. Again, I said if you are at the age of childbearing age, if you're woman, that's a very specific consideration. We have to know which medication will be safe for you as you are thinking of getting pregnant, as you are pregnant, as you are breastfeeding throughout this age, throughout this part of your life. Side effect. Talk to your doctor. We're gonna talk about this in a second. Talk about side effect. See why you're choosing this medicine. If I have history of kidney stones, then there are few medication I cannot be on. If I am challenged by weight gain, there are few medication I cannot be on because it's gonna make me gain more weight. So talk about the side effect of the medication, what to expect, how your body will react to this medicine, and be sure you talk to your physician about any kind of potential interaction between the seizure medication and the other medication that you are taking. Next slide. So when it comes to type of seizures, there are two types, very briefly, two types of seizures. The first one is, we call it generalized seizures, which means that your seizures are coming from the whole brain at the same time. It's not coming from one specific spot in the brain. It's coming from very diffuse process where it involves the whole nerve cell in the brain. That's called generalized seizures. And there are specific medication that work for this type of seizures. The second type is called focal seizures, which means that the seizures are coming from a specific area, whether it's the temporal lobe or the frontal lobe or the occipital lobe, the specific area that the physician is able to identify and tell you this is what kind of seizure you have. Then there are a different kind of medication that you might benefit from as a result of this focal seizures. Now, sometimes we don't know. As I said, diagnosis of seizures can be very challenging and we might not know. If you don't know, be sure when the physician is talking about the medications, be sure that you have a discussion is whether this medicine is going to be used for both type or is specific for one type. There are some medication that we can use for both types because we know from the studies that they work on both types of the seizures. So it doesn't really matter whether you know or you don't know. That's early on in the stage of the disease. If your physician does not know what type of seizures you have, if you don't know what type of seizure you have, and there's a need to start the seizure medication, we do have an alternative of starting what we call broad spectrum, which means medication that cover both options or both types of seizures. Next slide. So very quick, how it works, how the seizure medication, how can a seizure medication stop my seizures? Think about it this way. When you have a seizure, that means that you have too much excitation in the brain or you have very little inhibition of the brain. So the nerve cells are very excited, they are overworking, or they are very inhibited, they are very suppressed, and they are not able to suppress the seizure. So there are either too much excitation or too much inhibition. The medication that we give you will work on some chemicals in the brain to try to achieve that balance again. You have to have an equal balance between excitation and inhibition. And most of the medications, that seizure medication, they work through specific chemicals in the brain, and these chemicals try to, by working on these chemicals, the medication try to reset the brain rhythm, try to bring this balance between excitation and inhibition between the nerve cells. Next slide. So, side effect. This is the most important slide in my presentation. Every single medicine can be causing some side effect. I want you to think about side effect as two different types. There are side effects that's very common. They are very mild, and they typically start as you take the medications. And then after a few days or few weeks, you find yourself doing better. And the side effect and this kind of side effect are slowly resolving. This is, like I mentioned, this is very mild and they are very predictable. And a lot of patients, when they start taking the medication, they might feel dizzy, have a blurry vision, feel stomach, their stomach is upset. All the symptoms tend to improve over time after a few days or few weeks. It's not a reason to change the medication. We can start low. We can start at the lower dose and slowly go up on the medication. That will help to make you tolerate the medicine a lot better. One thing I want to mention here, if you like to read, that's great. We love for our patient to go and read. But when you read the side effect that's mentioned on the leaflet of the medicine, don't believe that every possible side effect is going to happen to you. because otherwise you will never take any medicine. And we don't want to take medicine, but we do believe that the benefit of taking the medicine will be a lot more than any potential risk of taking the medication. So you want to read, go for it. Read the side effect, but don't believe that you can experience all the side effects mentioned from the studies that's been done. Next slide. So that's one kind of side effect. The second kind is a lot more serious. And that's kind of side effect where you should be able to recognize and you should be able to speak to your physician right away. And you should, if you cannot seek the physician, if you cannot talk to the physician, maybe you should go to the ER so you can be evaluated and you will be advised what to do next. Some of this side effect, this slide and the next one, we can talk about some of this side effect. Having skin rash. Having skin rash can be, not always, but can be some very dangerous sign that there is something going on that need to be addressed by a physician. So if you start having skin rashes, if you start bleeding for no reason, bruising, if you start noticing that you're turning yellow, the color of the urine is not the same, if you notice that you are getting infection, all this kind of side effects, or sometimes your physician might do a blood test to check on your liver or your pancreas and find that there is something wrong. All these are serious side effects and they require to interfere or require to change the medication. Next slide. We just mentioned some of those serious side effects that you should be aware of so you can talk to your doctor. Don't stop the medication on your own. Just be sure you speak to your doctor as soon as possible. Any kind of rash or ulcers in your mouth, blisters on your skin, bleeding, stomach pain, severe stomach pain, fever, a lot of infection, anything that makes you concerned, please reach out, ask for medical help, talk to your physician, be sure that you are okay. Next slide. Now, one of the side effects that we heard about is, can the seizure medication affect my memory, affect my concentration, affect my attention? We get this question every time, multiple times every day. The issue of memory and cognition in epilepsy is extremely complicated. To give you a quick answer is yes, there is a chance that the medication can make your memory worse. There is a chance that your concentration will be affected from the medication. Remember, this medication works on the brain. They try to regulate the concentration of the chemicals in the brain. So it's not unusual or unexpected that you will find this medication affect your memory or your attention. Some medications might affect your memory a lot worse than other kind of medications. So if you're having memory problems, tell your physician, I'm having this problem. So maybe it will change the medication. Maybe he will keep you away from certain medication that can affect your memory and your cognition. Next slide. So we talked about comorbidities. A lot of patients with epilepsy have depression, anxiety, sleep, learning disorder, attention. Be sure that you talk to your doctor about these comorbidities, because selection of the medicine might be a lot easier if we try to treat more than one condition with one medicine. I'll give you an example. If you are depressed or you have anxiety, Keppra, which is one of the medication we use for seizure, might not be the best medication for you. I will not prescribe Keppra on someone who is already depressed, because there's a high risk that this person will get worse, his depression will be more severe if I put him on Keppra. I choose a medication that might have some mood stabilizer effect that will help him with his depression in addition to the epilepsy. The same thing with the weight. If you are challenged with weight, you cannot be on Depakote, a medication that increases your risk of weight. Maybe you will benefit from another medication that may help your seizures and help you to reduce the weight at the same time. That's how we choose the medication, looking at all these factors together to find the best medicine that fits you as an individual. Next one. Another question we get asked all the time, switching from brand name to generic medication. Here's what I would tell you. In most of the cases, there is nothing will happen if you switch from brand name to generic, in most of the cases. But remember, this two medication, the brand name and generic, are not equal. They are not identical. They are not the same. So yes, there is a chance that by switching from brand name to generic, there is a chance that you might see some seizures. There is a chance that you might get some side effect. Talk to your doctor. Don't be scared of changing or switching, especially if you have to, but don't be afraid. Most patients will be okay. We can be proactive. We can do some blood tests to be sure that there will be no changes in the drug level in the blood as we switching to the new medication. Next slide. So few more questions you need to talk to your physician about. how much I need to take of this medicine. What's the dose of this medicine? When should I take it? Every 8 hours, every 12 hours? Should I take it before food or after food? Is there any specific instructions I need to be aware of? We talked about the blood test. Do I have to do blood test? How often do I have to do blood test? When do I call the doctor? When do I call the nurse if they're having any kind of serious side effect or issue? So we finished with this. Can I have the next slide, please? So in the next maybe 1 or 2 minutes, I'm going to go very quickly over a few medications and can try to give you some examples of how to choose the medication. Like I said, there is a lot of medications. Typically, we tend to divide them into 2 big groups. The first one is the old medication, and the second one is the new medication. The old medication, next slide, I'm going to mention some example of the old generation. Those medications are very effective. They work. Example here, we have Dialante. It works for partial seizure. However, it can make your generalized seizure, especially if you have absence seizure or infantile spasm, it can make it worse. Remember, the type of seizure will help me as a physician to choose the right medicine for you. We look at the side effect, a lot of side effect. The last part of the slide shows the long-term complication, hair growth, neuropathy, cerebellar atrophy, problem with your balance, problem with your bone, a lot of side effect. That's an example of an old generation medication. We tend to avoid or stay away from the old generation, except if we have to, because we know they come with more side effect and they come with more long-term complication. We try to prefer the newer medication. Next slide. Tegritol or carbamazepine, another old medication, old generation. It works great. I have a lot of patients on Tegritol, but is it my first choice? Definitely not, because look at the side effect. Look at the long-term side effect at the lower part of the slide. It can lead to severe skin reaction. It can affect your liver, can affect the bone. It can affect your blood count. We try to stay away from it. If we have to, we have to, but it's not my first choice. Next slide. Depakote is a great medication for a specific group of patients. Patient with generalized epilepsy, young patient, a male. Thus, Depakote would be the best medication for him. It's the most effective medicine for generalized epilepsy. It comes with a lot of side effects. Look at the list. It can have some long-term complications, blood disorder, liver, affect the bone health, can lead to memory problems. All this has to be part of the decision what to choose and how to choose. Depakote we can use for seizures. If you have migraine and you are a young adult, you are male, Depakote will be a great medication for migraine, for seizures. If you have bipolar, mood disorder, Depakote will be a good alternative. Speak to your doctor, talk to him why you're choosing this medication. Next slide. Go through very quickly a few of the newer medication. Those are the second generation. They will not have as much side effects, or they are tolerated a lot better than the old medication. Keppra, Levacitram is a good medication. As I mentioned before, it can make your depression worse. It can affect your bipolar. It can make you anxious, snappy, angry. If you already have these symptoms, don't start on this medication, because there's a chance that it's going to get worse. We try to find something else that will help you with your seizures and your depression. But otherwise, it's a lot safer, it's a lot more tolerated than the rest, the old medication. Next slide. Glucosamine or Vimpat, another new medication. We use this as the first line in a lot of cases. It can affect your heart rhythm. We might get an EKG before we start the medication. It can affect the white count. Those are very rare. Those are not as common as the old generation medication. Next slide. Fycompa or Prempra is a good medication. It's really unique because it affects different chemicals in the brain. So most of this medication we discuss affect specific chemicals. Fycompa is not a new, but it's a medication that works through different mechanism of action. It works through different chemical called glutamate receptor. So it might be better option for some patients who failed the traditional way of the mechanism of action for some of this medication. Next slide. CBD, I'm sure I'm going to get some questions about the CBD. So FDA has approved CBD as a medication that's approved by the insurance, approved by the FDA. Now we know how much of CBD you can take. Now we know what kind of side effect from this medication you can have. Now we know what kind of interaction this medication can have with the rest of the medication you're taking. What I wanted to emphasize here, we thought CBD is safe and everyone can get CBD. And look at the side effect, diarrhea. The most common reason why my patients stop this medication is either because it's not working or because of diarrhea, severe diarrhea. Look at the increase in liver enzyme. We're talking about CBD. Who would know that CBD can lead to increase in the liver enzymes? We know that this medication, the CBD, can affect your Depakote and can interfere with your Depakote, can cause liver problems. So now we know a lot more about the CBD and its how it works in the cases of epilepsy, and what kind of things we need to look at, what kind of things we need to be careful, what kind of blood tests we need to do in order to be sure that it's a safe medication. Next slide. Another new medication that's, I think it's the most recent or the newest medication is Xcopri or Xenobe. It's a strong medication. I was impressed. One of the studies have shown that got the medication approved. 1 out of 5 patients taking this medicine might be seizure-free. That's what I wanted to emphasize. There's a lot of hope for the future. There's a lot of new medication that's coming around. There's a lot of effective treatment that we might see over the next few years. So we will never give up. We will always have that hope. We're gonna have to see what the experience, what the feedback we get from using these new medications in real life. Next slide. I will finish with this. There's another kind of medication that you need to talk to your physician about, is rescue management. If I'm having a seizure, what my family, what my friend, what my caregiver should be doing. There's a lot of things he can help you with at the time of seizure where you cannot help yourself. One thing he can help you is he can give you something called rescue management. And this is most likely based on a family called benzodiazepam. And benzodiazepam can work with very, very strong, very effective, very fast acting medication. It can be given through so many different routes: rectal, nasal, oral, or buccal. Next slide. There are 2 new medications that's been approved by the FDA. One of them is the nasal diazepam, and the second one is the buccal, where you can put under the behind the lip, between the lip and the teeth. Be sure you don't get your finger bitten by the person who's having a seizure. It's typically used for patients who's having cluster of seizures in children 6 years or more. I know it's a lot of information, but I hope I will leave you with some kind of insight of talking to your physician about why he's choosing this medication. Talk to him about the side effect, talk about the comorbidities, talk about long-term complication, talk about your memory, your behavior, your mood. All of this will affect his decision of why he's choosing this medication. With that, I will finish. Thank you for your attention. I would love to have any questions you have. This slide we talked about, so thank you.
Thank you, Dr. Zakaria. And we do have one question related to drug interactions between antidepressant medication and anti-seizure medication.
So it's a great question. Like been mentioned before, a lot of patients with epilepsy, they have depression, and we cannot just ignore that. We cannot say we cannot focus on the seizures and don't focus on the epilepsy. We have to talk about everything. And most of the most of the antidepressant, most of them are fine, are okay. The risk of increasing the seizure is extremely small, that the benefit will outweigh any potential risk, and we prescribe this medication all the time. However, there are few medications that they tend to increase the seizures. So please, if you are going to start on taking new medication, be sure you speak to your neurologist. If it is prescribed by psychiatrist, if it is prescribed by primary care doctor, speak to your neurologist or your epileptologist. Be sure you talk to him, let him know that you are starting a new medication, and he will give you the final approval. And this applies to antidepressant and apply to all the medication that you're going to start on. Be sure, pain medication sometimes can increase seizures. Depression medication can cause seizures. Be aware of the medication and any.
Thank you very much, Dr. Zakaria. Wonderful. You've covered so many of the questions that were originally posted through your presentation. That was the last one that we had.
Awesome. Thank you, Dr. Zakaria, for your session here. It's been a great afternoon, guys, filled with knowledge and great discussions. And thank you so much to our doctors for taking the time to be a part of our symposium. We would also like to thank our presenting sponsor, SK Life, and to our other sponsors, Memorial Healthcare Systems, Advent Health, Greenwich Biosciences, Neurelis, Aquestive, ASI, LeaveNova, and TrueLeave. Thank you all for supporting us for today's symposium. If you enjoyed today's symposium, you can continue to support Epilepsy Florida and visit us at give.epilepsyfl.com. We appreciate everyone for spending the afternoon with Epilepsy Florida, and we look forward to seeing you all at our next event. Be sure to keep taking those pictures with our virtual photo booth and tag us on Instagram at EpilepsyFLA. Stay safe out there, wear your masks, and enjoy the rest of your